So, you know what we'd like to do now? Let's talk about treatment planning. And let me explain to you how easy it is when you're working with a restorative specialist. In essence, when I sit back and I look at a case, I make I look at each individual tooth, I look at the periodontal condition, I'll look at what crowns need to be redone, if any, and then I will, in my letter, say to my restorative specialist, can you place a core in a dry environment that will not be contaminated on this tooth? And if he says yes, pretty much periodontally, I know I can keep the tooth. If he says no, then the tooth should be extracted. So really, the key to perio-restorative treatment is the core buildup, in my opinion. Once that can be done and done properly, free from contamination, the case is a winner. Remember what I just said. It is a restorative world and you control everything. And so I was working with a perio-restorative periodontist that does restorative, and we were just talking back and forth, and I was talking about cores, and he said, they don't work very well. And I said, well, they do with us. They work very well. He says, well, when I use them, they fall out. They're not very good. I said, well, send me one of your cases. And so he sent me this case, and he put a composite in. He considers this actually his provisional too, his core and his provisional. And he did surgery. And first, we're talking about treatment planning. How come he's not including this amalgam or this amalgam that's broken, these amalgams that work? What's the true treatment plan here? There isn't one. How he could single out one tooth out of 4 teeth doesn't make any sense to me. But that's his right, and that's what he did. Then he went on to finish his surgery. If you're a periodontist and you're going to leave the final margins of your old amalgam subgingival, you didn't even accomplish the basics. It is mandatory that when we do surgery, regardless, all margins of old restoration should be supragingival. But in this case, it's still subgingival. And so when I look at a case, for instance, this was referred to me by a really good, just starting out restorative dentist. He'd been out in practice about a year. He was just getting his practice going. And money was tight, as we can understand. And he said to me, you're going to be seeing a new patient, and I've got her committed to doing provisionals on 14 and 15. Please don't lose her, as she's my only patient next week, and she can't afford to do any more. So you can see the whole side, everything's broken, the amalgams are rotted, and so on. And so when she came to me, she had provisionals on 14 and 15. And we were having a discussion, and I always try to discuss everything from a restorative standpoint. And I said to her, so next year when we're ready to do the 2 bicuspids, we'll be doing surgery again because I need provisionals. And she said to me, if I was to have those temporaries put on now, could I do the surgery at just one time? I said, certainly. She says, then let's do all 4. See, in his mind, he did not want to lose the patient, which I understand. I simply presented logic to her, and she said, okay. If she would have said to me, just do the 2, we would have been no worse off. And she came back with the 4 provisionals. And remember, this is a young dentist right out of school, or, 6 months or so, a year. And he's doing a great job. So when I looked at the case, there's the calculus, there's everything. He did as best as, these are very, very good cores. Are they perfect? No, but they're what I needed. And then I did my surgery, did what I had to do. But the point of this is, whereas I'm thinking total picture, he's thinking, what can I make today?